If you are experiencing vaginal dryness, I mean frequent vaginal dryness, not something you experience once a while. If it is something you experience once a while, I think that is normal. But once it has become, I mean, something you experience from time to time, that is a cause for alarm. You need to be concerned about such a condition, especially if you are a young lady who is not close to your menopause. It should be a serious concern to you. The vagina is designed to be moist always. It's supposed to be wet or moisturized always. There is a hormone that is responsible for keeping the vagina healthy and moist. Estrogens are responsible for this job to keep the vagina healthy and moist. So as soon as you start experiencing vaginal dryness frequently, the first thing that should come into mind is reduction in estrogen production. And that also means there could be a problem with your reproductive system. And that is enough for you to be concerned. If this continues, it can affect you in so many ways. One way it affects you is that it can delay conception. It doesn't directly affect fertility, but it can really negatively impact fertility. It will delay conception. This is because during sexual intercourse, you are going to experience intense pain and discomfort. And this pain and discomfort will make you dislike sex. And imagine if you want to naturally get pregnant and give birth, it will be a very big problem, for you. So it can really prolong or it can really delay, your conception. Another thing is that moist environment or wet environment promote the motility of sperm cells. You see, the environment of the vagina is very hostile. I tell you, most of the sperms die in the vagina. Only few sperms are able to swim through the cervix into the uterus and to the fallopian tube. Most of them die in the vagina because the place is hostile. And then when the place becomes dry, it makes it more hostile. And most sperm cells are going to die right in the vagina. They will not even be able to make it into the fallopian tube. And these two things are going to delay your conception. So dryness of the vagina can really, indirectly affect fertility. Another thing is that it can increase your chances of getting infection, especially sexually transmitted diseases, because during intercourse there are going to be micro bruises due to the thinning and the dryness of the vaginal wall. And these micro bruises will expose you to sexually transmitted diseases like gonorrhea, syphilis, chlamydia, HIV, hepatitis B. It is very serious. So you see, vaginal dryness, it is not something that we should, be happy about. Are you getting it? That is it. So what are the causes of vaginal dryness? One is dehydration. If you don't take enough water, you don't eat foods that contain enough moisture or enough fluids, you are going to be dehydrated. And once you are dehydrated, your vagina walls are surely going to be dry because the walls are made up of tissues that needs water to maintain its moist nature and its elasticity. So once you are dehydrated, definitely your vagina is going to be dry. Another cause is menopause. After menopause or during menopause, estrogen level drops down drastically. Not completely, because the adrenal glands on the kidneys also produces some amount of estrogen. but most of the estrogens are produced from the ovaries. And after menopause, the ovaries stop functioning, they stop producing estrogens, and that will potentially lead to what we call vaginal atrophy, and the vagina loses its moisturizing and elasticity property, and you begin to experience discomfort, burning sensation, itchiness, painful sexual intercourse. So, menopause is another cause. Another cause of vaginal dryness is bad personal hygiene practice like douching, putting substances down there with the motive of trying to keep the place clean or hygienic. No, it is a bad practice. The vagina doesn't need your assistance to keep the place clean. It is self-cleansing. It has been given that self-mechanism to keep itself clean. You understand? It has its optimum pH, it has beneficial bacteria, it also has its own natural secretion. So these three factors come together to keep the environment of the vagina clean and hygienic. So putting stuffs there, what you are doing is that you are altering the optimum pH, you are altering the conducive environment of the normal flora or the beneficial bacteria. You are also altering the natural secretion of the vagina, and these can lead to vaginal dryness. So stop putting things down there. Another thing that can cause vaginal dryness is childbirth. After childbirth, as soon as the placenta is expelled from the uterus, estrogen level drops down drastically after 24 hours. Yes, and also breastfeeding. Estrogen level remains down throughout breastfeeding. Another cause of vaginal dryness is smoking, alcoholism. These are the causes of vaginal dryness. So, what are the solutions to vaginal dryness? One is to take enough fluid, drink a lot of water, eat a lot of fruit and vegetables to keep your body hydrated, because the vaginal tissues needs fluid to maintain its elasticity and its moisture. So once you get your body hydrated, your vagina is not going to be dry, or you are going to see an improvement if you have been experiencing frequent vaginal dryness. Another solution is to stop putting things down there. Allow the vagina to perform its responsibility. Solution number 3 is to stop smoking and drinking alcohol. Solution number 4, practice adequate foreplay before sexual intercourse. Number 5, you can use recommended lubricant and vaginal estrogen. But with causes like breastfeeding and childbirth, these two are self-reversible. As time goes on, estrogen level will shoot up to normal. You understand? So these are the solutions to vaginal dryness. Thank you for watching this video. If today is your first time of coming across my channel, this video, kindly hit on the subscribe button and turn on your notification bell so you can keep on receiving educative videos like this from my channel. I will see you in my next video.